Who would have thought a perfect couple who were leading a perfect life could end up in a great tragedy that shocked the world? April 17, 2013, the 911 operator had received a call from Mr. Robert Frante, husband to Dr. Autumn Klein, regarding the condition of his wife, which was described by Mr. Frante as alive but unresponsive. The distress sound in his voice and the horrific, guttural moaning of Dr. Autumn gasping for air had moved the jury for a second on how the real situation was. A few hours back, the couple had texted back and forth about the supplement's ability to help them conceive their second child. Dr. Autumn Klein was born on November 13, 1971 in Baltimore. Her parents, Louis and Bill, instilled strong values in their only child and treated her with an active sense of happiness. The family was especially close, and Autumn was blooming. She was kind but quiet and observant, and also an honest student. She excelled academically and later became a respected neurologist specializing in epilepsy and seizures in women. In 1995, Autumn worked in a laboratory at the Bedford Veterans Administration Medical Center during her doctoral studies, where she met Dr. Robert Frante, who became her husband on May 18, 2001. 10 years later, the couple moved from Massachusetts to a new life in Pittsburgh. At the age of 62, Bob was a leading researcher that involved developing drugs therapies in the treatment of neurological disorders. Even though Bob enjoyed his career as a researcher, he was considering retirement, but his 41-year-old wife showed little interest in slowing down. Considered by many to be brilliant, Dr. Autumn Klein was named Chief of Women's Neurology at UPMC Pittsburgh's largest health system. She also was an international speaker and received several prestigious grants. On the night of Wednesday, April 17, Dr. Klein worked a double shift, and shortly before 11:30 p.m., she texted her husband that she was on her way home. Less than an hour later, Dr. Autumn Klein Ferrante was wiping the kitchen floor. Her husband hovered over her while holding the phone, trying to explain to 911 about his wife's condition. Mr. Ferrante pleaded for help, stating that his wife appeared to be having a stroke. He said she returned home from work, complaining about a headache, and proceeded to collapse. EMT swiftly arrived to the scene and assessed the patient. Paramedics stiffly sent supplied a Ziploc bag that filled with a white powder on the counter kitchen. Mr. Franti proceeded to explain that it was a creatine powder his wife taking for infertility because she wanted to have a second baby. Dr. Autumn Klein was admitted to UPMC, and after several trials of trying to save her, Klein was pronounced dead at 12:31 p.m. on April 20, after tests confirmed that Dr. Autumn Klein would not recover. Her husband made the difficult decision to remove her from life support, but remained on equipment to keep her heart beating and her lungs functioning in order to facilitate organ donation. The treatment team, which now included a neurologist, a cardiologist, and an intensive care unit physician, had received Klein's initial lab results, looking at her electrolytes, white blood cell, hemoglobin, red blood cell volume, and coagulation factors. Again, they were normal. The only things that came back abnormal were the patient's pH and oxygen levels. There was a lot of acid in her blood, indicating a severe metabolic dysfunction. What could possibly have happened to this healthy and fit woman who eagerly wanted a second child and was leading a brilliant life?
The method of crime in the murder of Dr. Autumn by her husband, Dr. Robert Frante, involved the deliberate use in cyanide poisoning. Dr. Frante, a prominent researcher at the University of Pittsburgh, ordered cyanide under the guise of using it for research purpose. He used his university credit card to purchase 250 grams of potassium cyanide from chemical supplier company. This purchase was made under the pretense of needing it for laboratory research. Once Dr. Frante obtained the cyanide, he kept it in their house. The question is how Dr. Frante treated his wife and how he hid the presence of cyanide. Dr. Frante prepared a mixture of cyanide with a keratin supplement before giving it to his wife. The poison was likely dissolved in liquid to hide its presence. Since cyanide is highly soluble in water and it able to act quickly when digested. On the evening of 17 April 2013, Dr. Frante offered Dr. Autumn a drink that he claimed would help fertility. It was actually a creatine supplement drink purportedly to aid their attempt to pregnant another child. Shortly after consuming the drink, Dr. Autumn began showing symptoms of acute cyanide poisoning. He collapsed at their house and was found by her husband, Dr. Frante. Dr. Frante is the person who called the emergency service. He said that his wife was having a stroke.
Dr. Autumn Klein and her researcher husband, Robert Ferrante, appeared to have an idyllic marriage. The couple shared a young daughter and were hoping to expand their family with a second child. But those dreams were shattered when Klein experienced a mystery medical crisis on the evening of April 17, 2013, just after arriving home from work. Prosecutors think that Ferrante spotted his wife messaging and emailing a male co-worker she had spent time with at the conference, which sparked tremendous jealousy. This envy was viewed as a significant reason in his decision to kill her. Ferrante is fear of divorce and loss of assets. When he suspected his wife having an affair, which could have led to a divorce, he afraid that he will lose all the assets and the life they had built together. Investigators said they discovered evidence that Ferrante had confronted his wife 3 times within weeks of her death as to whether she was having an affair or not. Ferrante was concerned about losing power and position because the couple had relocated to Pittsburgh for an opportunity presented to Autumn Klein, which resulted in her career raising while Ferrante's collapsed. This perceived danger to his rank and authority might have driven his determination to get rid of her.
In order to properly convict Dr. Robert Ferrante of the first-degree murder of his wife, Dr. Autumn Klein, proper evidence needed to be collected, and in this case, there are several. The first evidence is regarding the cyanide purchase. Investigators learned that Ferrante, who operated a research lab at the University of Pittsburgh, had ordered cyanide to be delivered to his lab just days before Klein's collapse and death. The Pittsburgh police detective, Jim McGee, said that in the months before Klein's death, investigators found evidence that Ferrante had been Googling cyanide and had placed an order for the toxin to be delivered to his lab just 2 days before Klein fell ill, and Ferrante had used his university credit card to make this purchase. This has raised suspicion amongst the police as Ferrante's research required no use of cyanide. Ferrante also did online searches on cyanide poisoning and how it might be removed by medical treatments received or detected by a groaner after a death. Not only were his fingerprints found on the container, but 8.3 grams, or about a teaspoon, was found missing from the container. When asked on the stand about the 8 grams of missing cyanide in his lab, Ferrante had just responded with an "I don't know." This was seen as incriminating by the jury because if Ferrante really had used the cyanide for his research, why would he not just be clear with it and explain? The second piece of evidence collected was the amount of cyanide found in Autumn Klein's blood. At the hospital where Klein was being treated, the medical doctor in charge of her treatment, Dr. Andrew Farkas, asked whether Ferrante knew if Klein had suffered previously from headaches. Ferrante stated that Klein had complained of not feeling well right before collapsing. When placing an IV in Klein, Dr. Farkas observed that Klein's blood was an abnormally bright red. A test on Klein's blood revealed a lethal level of cyanide. The blood was drawn while the doctors at the hospital were trying to save her life, though the results weren't known until after she died and her body was cremated. The hospital ran a spectrum of tests, and one of the results reportedly was an unusually high level of acid in her bloodstream. Cyanide rapidly reacts with ferric ions of cytochrome oxidase, a mitochondrial enzyme that is responsible for oxidative phosphorylation in the final pathway of cellular respiration, and the inhibition of oxygen utilization causes the sudden surge of anaerobic metabolism, hence resulting in a high level of acid in the blood from lactic acidosis. Last but not least is Ferrante's own statements. Ferrante had told paramedics that the Ziploc bag containing white powder found in the kitchen contained creatine, which Klein took to help with her fertility, as it was said that the couple were trying for a second child, with Klein believing that it could patch up their unhappy marriage. Prosecutors believed that Ferrante had mixed the cyanide into the creatine before giving it to Klein, and based on the text between the two, Ferrante had encouraged Klein to take the creatine when Klein had asked if it would stimulate egg production, and Ferrante had just replied with a smiley emoticon. Besides that, Ferrante also claimed that the cyanide he bought was for stem cell experiments of Lou Gehrig's disease. However, this was not true, as police found that none of Ferrante's research required the use of cyanide. There was also the case of Ferrante changing his statements. Police said that Ferrante told them and a medical colleague that he was downstairs in the kitchen and gave his wife a creatine drink before she collapsed, but on the witness stand, Ferrante said he was upstairs when she got home. He didn't know if she drank anything and she collapsed after kissing him on the cheek. The jurors said that Ferrante changing his story about where he was and what happened in his wife's final moments ultimately led them to believe that he was guilty and lying.
Statements are expected to begin tomorrow in the trial of Dr. Robert Ferrante.
A 3-week trial for 66-year-old Robert Ferrante and sentenced him to life in prison with no chance of parole.
Mr. Diefenderfer said this afternoon, or late this afternoon, in fact, that he was disappointed by the jury decision.
Robert Ferrante on trial now.
The trial of Robert Ferrante took place in the Allegheny County Courthouse, overseen first by Judge Jeffrey A. Manning and later by Judge Bruce Beamer after Manning's retirement. The prosecution selected 11 local jurors, comprising of 8 men and 4 women, and presented 50 witnesses. Ferrante's defense team, led by William Diefenderfer and Wendy Williams, presented 19 witnesses on their support. Ferrante was charged with the criminal homicide of his wife, Dr. Autumn Klein, on July 24, 2013. His trial ran from October 2014 to November 2014, resulting in a guilty verdict for first-degree murder. In February 2015, Ferrante filed several appeals and motions, but was unsuccessful in all of them. Ferrante was found guilty of first-degree murder based on the unanimous decision of the 11 jurors as well as the circumstantial evidences. Since there were no special circumstances to justify death penalty, he was sentenced to life without parole instead. The key evidence that led to his verdict included Dr. Klein's blood test result that showed a lethal cyanide level of 3.35 mg per liter, despite initial defense claims of report inconsistencies. It was also found that Ferrante had purchased 250 grams of potassium cyanide on April 15, with his fingerprints found on the bottle. It was believed he mixed 8.3 grams of cyanide into creatine supplement drink he recommended to Dr. Klein for fertility improvement. She consumed the drink on April 17, collapsed, and later died. Ferrante's internet search history suggested premeditation of the killings, and his changing in testimonies about his whereabouts weakened his defense. Upon his trial verdict, Ferrante filed several appeals, including the race on disclosure of Nichols Institute's criminal conviction. However, this claim was denied as the conviction involved a different test and substance, not directly related to the case. He also claims on whether the circumstantial evidence was actually sufficient for his conviction. This claim was also denied as the court found the evidence strong enough to support the verdict. Ferrante had challenged the Superior Court on his appeal on whether the guilty verdict of his first-degree murder was actually against the weight of the evidence. This third claim was also denied as Ferrante failed to raise this issue initially in the trial court. Due to the failure of Ferrante to preserve the claim before the trial court, the Superior Court was unable to pursue the claim in their review. He also raised his claims on the suppression of evidence from the Commonwealth illegal searches, and this claim was also denied. It was suggested that the claims should be deferred to Pennsylvania Post-Conviction Relief Act PCRA's review first, in which shall be raised way before the appeals hearing as pleading petition to his conviction and sentencing. Hence, direct appeal shall not be entertained with such claims, resulting the claims was also denied. All of Ferrante's appeal were dismissed except for one, whether his defense counsel had a reasonable basis for withdrawing the motion to have the jury selected from outside the area or the change of venue, and whether this decision harmed Ferrante. A hearing on this issue was held on October 20, 2017, led by Judge Bruce Beamer. Beamer highlighted Ferrante's failure to prove that his counsel had no reasonable basis for the decision. Beamer also refused to reconsider Judge Manning's initial rulings as it was against court rules. Thus, Ferrante's appeals were entirely dismissed.
In a nutshell, it was proof that forensic toxicology played a crucial role in the investigation and trial of this case. It was proved when Dr. Todd Lukasiewicz, who conducted the autopsy, testified his examination and information from Quest Diagnostic led him to conclude that Dr. Klein died as a result of cyanide poisoning and that her death was a homicide. Also, a test done by Quest Diagnostics on blood drawn from Klein hours after she collapsed in her house showed a lethal level of cyanide. These forensic toxicology findings were crucial in establishing the cause of death and linking Dr. Ferrante to the crime, ultimately leading to his conviction and life sentence without parole.